Okay, welcome. I'm a little late. Sorry about that. It is 1:08 Eastern Standard Time, and this is another session of Dr. Yass Live on YouTube. Today, we are going to discuss something that I wanted to really hit on. It's quite specific, but it seems to be something that's very common, and there seems to be a lot of questions regarding it. And unfortunately, it's also the same type of thing that might lead someone to get a knee replacement fairly quickly because of the confusion as to what's creating pain. And what I'm referring to is pain associated with bending the knee or kneeling on the knee. And this is a very common thing that happens. So let's say that you were sitting in your chair, you had to have your knee bent to 90 degrees, you try to stand up. Well, that was bending the knee for a period of time and standing up. If you have to climb stairs, you're going to have to bend your knees. If you have to reach down to grab something, you're going to have to bend your knee. And including the idea of if you kneel, you're going to have to bend your knee. So, and in that particular case, apply compression to the knee. So I wanted to discuss the mechanism that is leading to pain around that kneecap. The most common thing I believe that people are told is that the cause of that pain is associated with arthritis of the knee. And so what happens is the person has this pain and they end up going to seek medical care. And so, of course, the doctor is going to take some sort of diagnostic test like an X-ray or MRI. They'll find some arthritic change in the knee and they'll be told that's the cause of the pain and therefore you need a knee replacement. And the problem with that, and I want people to start trying to be a little bit smarter if they can, is the idea that if arthritis was causing the pain, if the actual process of arthritis was causing the pain, then why wouldn't you have pain 24 hours a day, 7 days a week, regardless of the position of the knee joint? That's something that you have to start trying to ask yourself when it comes to these diagnoses of structural causes as the cause of the symptoms. Remember, these structural variations exist, right? And so they exist 24 hours a day, 7 days a week. So if you're being told that the actual process of arthritis at the knee is causing your pain, then you should expect that you're going to have pain 24 hours a day, 7 days a week. It's not going to change, right? But you notice that the pain only occurs when you bend your knee, and the pain is around the kneecap. Let's make sure we also understand that there's two joints associated with the knee joint. There's the joint between the thigh bone and the lower leg bone. And then there's the joint between the kneecap and the thigh bone. And your pain is around the joint between the kneecap and the thigh bone. And it's this, when you compress, when you bend your knee, that kneecap's being pushed into the joint more, right? So if someone were to tell you that the cause is some sort of structural variation, like a meniscal tear or a bone on bone or arthritis, just remember that what they're describing is the joint between the thigh bone and the lower leg bone. Remember, that's where they're talking about those structures occur. And because it's actually a completely separate joint, the joint between the kneecap and the thigh bone, there's no possible way that arthritis, a meniscal tear, or bone on bone that's associated with the joint between the thigh bone and lower leg bone can create pain at the joint between the kneecap and the thigh bone. So let's really try to hone in on what is the mechanism that's leading to your pain. So you want to understand the idea that the quadricep mechanism, the front thigh mechanism, begins all the way at its attachment at the pelvis. It actually attaches to the front of the pelvis, okay? And actually, if you kind of look right over here, this little protuberance sticking out in the front here, that's known as the ASIS. Then there's kind of a little small one right underneath it. That would be where your quadricep would attach, and then the quadricep runs down the front thigh. So it attaches to the pelvis. The muscle itself runs down the front thigh. Then it attaches via a tendon called the quadriceps tendon and attaches to the kneecap. The kneecap then extends down beyond it lower via the patella tendon and attaches to the lower leg bone at a point called the tibial tuberosity. So we have a mechanism that begins at the pelvis and ends at the lower leg bone at the attachment of the patella tendon to the tibial tuberosity. So you have one continuous type of structure or mechanism running this entire distance. So the kneecap sits within that entire length, right? So if we were to bend, so we start with the knee straight. This is my thigh bone. This is my lower leg bone. And I go to bend my knee. You have to recognize that the tendon attaches to the tibial tuberosity here. So as I bend my tibia going back, there's going to be stress put on this entire mechanism all the way from this point here. I'm sorry, this point here, the ASIS or AIIS, all the way to the top of the middle, all the way down along that structure, along that mechanism to the lower leg. And that kneecap sits there. So if you were to bend the knee, you're creating a pull on both sides of the kneecap. So the kneecap, instead of simply gliding through what is known as the intercondylar groove in the thigh, the end of the thigh bone has two protuberances and it has this little hole here. That's where the kneecap glides through. So if the kneecap was pulled on both sides, pulled down, it's going to be pulled deeper into the intercondylar groove than it should, and therefore there'll be a compression. That excessive compression is what leads to irritation of the underside of the kneecap as it's running through the groove that sits between the two sides of the femur, the thigh bone. So the reason that you're having this problem is that there is too much of a tension in the quadricep muscle. The quadricep muscle is that thigh muscle. So if it has shortened because it's, say, much stronger than the hamstring, the posterior thigh, it's going to pull excessively. And then it pulling excessively, it's going to create a greater upward tension on that kneecap, which is going to lead to greater compression of the kneecap in the joint, which is going to lead to excess irritation and pain. So the primary reason that people have pain at this joint between the kneecap and the thigh bone is typically excessive upward force of the quadricep, because the quadricep turned out to be much stronger than the hamstring and it gave it the ability to shorten. Just remember that everything you do is in front of you. When you're walking, you walk in front of you. When you climb stairs, it's in front of you. When you go to sit down, that's done in front of you. Everything is being done in front of you. So there's a high probability that the quadricep muscle is much stronger, or to some degree stronger, than the hamstring, the posterior thigh muscle. If that muscle was to increase its imbalance great enough, well, now it's going to shorten to such an extent that it will create this excessive upward pull on your kneecap, which is going to lead to excess compression. Now, with that excess compression, that kneecap really jammed in. Just imagine what happens if you go to kneel on it. It's really going to be painful. So the solution to resolving for almost everybody pain associated with bending the knee or kneeling on the knee at the joint between the kneecap and the thigh bone is stretching the quadricep muscle and strengthening the hamstring and calf muscle. And the portion of the calf muscle I'm referring to is the gastrocnemius portion, and that's because a portion of the calf actually passes the knee. So if we are able to create enough opposing force, including the calf and the hamstring, this is what will allow the quadricep to maintain its optimal length and allow it to limit any excess compressive force that might develop on the kneecap. If you want to test my theory that this pain that you're having at the joint of the kneecap and the thigh bone is created by this imbalance, all you have to do is try to stretch your quadricep muscle, right? And to stretch your quadricep muscle, you're going to try to grab your ankle, not your foot, but grab your ankle, start to bring your heel towards your butt, making sure that the knee is about 1 inch to 2 inches behind the hip joint. Hold that stretch for 20, 30 seconds. then put your foot down and try to walk around. And if you see a reduction in your knee pain, you have just proven that the cause of that pain is muscular. It's muscular. It's not structural. It doesn't matter that arthritis or a meniscal tear were found, or that you were being told you were bone on bone. That's another fallacy, right? What everyone's running into trouble with is the fact that you're going to people who are incapable of identifying muscular causes, and as a result, they depend on diagnostic tests to find structural causes. Once those structural variations are identified, they make no attempt to determine whether the symptoms you're experiencing are coming from that structural variation or whether it's simply an independent variable. You know it potentially could be an independent variable because studies have shown as many people with no pain have the same type of structural variations as those with pain in almost the same percentages. We have to start becoming a lot smarter. And as far as I'm concerned, unless there's a willingness at some point for the medical system to move away from the use of diagnostic tests as their primary mechanism for diagnosing pain, I'm not really sure how you could trust these individuals to give you an appropriate diagnosis. Remember, in establishing a diagnosis, you must be able to identify all potential causes so that whatever it is, you're incapable of identifying it. But if you're only willing to accept diagnostic test findings, which only find structural variations and cannot identify muscular causes, which I've shown in 98% of cases are the cause of most people's pain, there's a high probability that you're going to miss the muscular cause. And you're just going to keep trying to treat the structural causes, which in the case of this, what do you think the answer is? Well, you're going to get a cortisone shot. You're going to get this stuff called Synvisc, which is supposedly going to try to thicken up the meniscus, and just a lot of nonsense. And eventually you'll start heading towards surgeries like meniscectomies and debridements and eventually joint replacements. And the scary part is that person gets that joint replacement supposedly based on the idea that they're going to improve the structure of the joint between the thigh bone and lower leg bone, when your pain is actually at the joint between the kneecap and the thigh bone, a completely separate joint. So it can't be confusing after you get the knee replacement while you're still having that pain around your kneecap. It's because the treatment that was provided wasn't even addressing the appropriate joint. So let's try to make sense of these things. I try to pinpoint different types of topics to speak about because these just seem to be very common topics that people are running into and reach out to me. So I'd like to have the YouTube channel be an opportunity for people to get answers about these very common things, because clearly if it's common, it's not just that person who contacted me, it's many other people having the same problem and having difficulty in resolving their symptoms. It's really kind of cool. I did this webinar for the India, as in the country, the India Rheumatology Association, and it was quite fascinating that one of the rheumatologists pointed out that it is a very common concept that when people are having pain at the patellofemoral joint, this joint between the kneecap and the thigh bone, that their common practice is to strengthen the quadricep muscle. And I pointed out to him that it is much, much more apt that the quadricep, because everything functionally is done in front of you, is much stronger than the hamstring, and that in strengthening the quadricep, you're actually leading to it shortening further. It actually leads to it shortening and increasing the compressive nature on the kneecap, causing greater pain. And it seems that that was a common problem that was happening. They're having difficulty resolving people's pain, and these people are sustaining chronic pain because even though they suspected that there might be a muscular cause, that the tissue in distress was muscle, they didn't know how to address that muscular cause appropriately. And as I said, with him trying to strengthen the quad, which was, he told me, is the standard of care in India for patellofemoral pain, he didn't realize that, in effect, they were actually sustaining the pain of these patients that were trying to seek care to resolve their pain. And once I explained to him that you needed to achieve full range of motion, full flexibility of the quadricep before you try to strengthen it, he actually said to me, which was quite humbling, "Thank you for providing a revolutionary understanding to how to address patellofemoral pain. It was quite comforting for me to understand that this understanding I have, which basically is self-derived through my experiences and my personal understanding that I developed by basically taking physics and applying it to weightlifting and understanding the mechanics of joints, that it was going to now help these people to treat the patients that were coming in with patellofemoral pain and actually help them resolve it once and for all, very quickly, by the way. As I said, you could actually determine if the quadricep shortening is the cause of the patellofemoral pain simply by doing the stretch. And if you do confirm that, well, it's quite simple. Stretch the quad, strengthen the hamstring and calf, and you'll have your pain resolution in a week, 2 weeks, not very long. The key, of course, is knowing how to use progressive resistance, right? We have to make sure that we're using the right level of resistance to cause the muscles we're trying to strengthen to adapt and get stronger appropriately. So hopefully this was, it's only a short video and a short session, but I really wanted to hit home on this. It seems to be a very, very common problem, and I think that it required its own session to discuss. So again, just to review, the common reason for pain at the knee with bending or kneeling is an excessively shortened quad due to an excessive strength imbalance between the quad and the hamstring and a portion of the calf, which has led that quad to shorten, compressing the kneecap excessively when you bend or kneel. The resolution comes from strengthening the hamstrings and the gastroc portion of the calf and stretching the quad. And if you want to know how to achieve these goals, you can certainly go to my books, Overpower Pain, the Pain Cure RX, or the Yass method for pain-free movement. Or you can contact me directly if you'd like to actually have a Skype or Zoom session. You can contact me directly at Dr. Mitch at mitchellyass.com. That's DRMITCH at MITCHELLYASS.com. If you like this video, if it makes sense to you, if it's helping you to have a clear understanding of what's causing your pain, and it's making more sense versus just the typical solution from the medical establishment that you have arthritis or a meniscal tear and surgery is the only way, then please give it a thumbs up. If you like this video and any of the other videos that I'm putting on my YouTube channel, Dr. Mitchell Yass, please subscribe to the channel. It's a way of showing that people are appreciating the types of information I'm providing, and it also helps me to get a higher rating on Google and YouTube, and they'll be more apt to suggest my videos for people when they put in certain keywords. If you do subscribe, you do get notification when I put new videos on or when I'm live on YouTube. So it's great for you. I think that finishes off this particular session. So for now, I'd like to say this is Dr. Mitchell Yass, wishing you a pain-free, fully functional life. Let's all work together to try to help resolve the issue of chronic pain. Chronic pain exists for one primary reason: misdiagnosis. And that really relates to the overall global approach to treating pain from the medical establishment. If you find out about the Yass method and you see its value and the logically based understanding that it has in achieving a diagnosis and treatment, please try to help spread the word and let people know that this exists so they can resolve their pain. And together, we can help people achieve a pain-free, fully functional life. That's what everybody's looking for. That is your right. I think everybody should have that type of opportunity to do what they want when they want. So for now, again, this is Dr. Mitchell Yass, wishing you a pain-free, fully functional life. Bye-bye for now.